In recent years, individuals who identify as transgender have become more comfortable when coming out as transgender. They also have been seeking gender transition services such as altering their appearance or their voice. Speech language pathologists are qualified in providing treatment for voice modification. However, we feel ill-prepared to provide these services as they are unaware of the needs for the transgender community when addressing voice feminization and masculinization services. Current research has found that there are numerous intervention strategies that have proven effective to alter the voice, however they are addressed towards voice disorders. Transgender individuals are not characterized as having a voice disorder, however their voice does affect their daily life, so this is an area that speech language pathologists are able to address and work on with these individuals. This research targeted researching and synthesizing 11 peer-reviewed empirical studies that were published between 2010 and 2020 to answer the research question, how can SLPs best support individuals who identify as transgender? There were three main themes that were identified amongst this literature review: cultural competency, quality of life care, and intervention services. Cultural competency addresses using gender-inclusive terminology, being culturally sensitive when choosing assessment and treatment materials, and then also providing gender-affirming and safe health care by using the most current and evidence-based strategies. Quality of life care addresses psychological effects that can arise when there is a gender incongruence with the voice, such as depression, anxiety, low self-esteem, and overall life satisfaction. SLPs can address this by counseling and providing education when also addressing voice modification therapy. In intervention, there are many techniques used for altering voice. However, there is still growing in how these techniques can be used to help the voice sound feminine or more masculine. The main characteristic found is to address fundamental frequency or pitch in order to sound more feminine or masculine. Overall, all these studies in this literature review have identified that there are main areas that SLPs can address when providing these services to individuals who identify as transgender. We must integrate all aspects of cultural competency, quality of life, and intervention services when addressing gender transition treatment. These studies add important information, however, most of these are single subject research designs and do not show long-term effectiveness. Future directions can use a larger sample size to improve generalizability, and then also investigate the long-term effectiveness of voice and communication treatment for individuals who are transgender.